welcome to this recording. It's a collaboration between Sussex Rights and the Youth Cafe Kenya. We have a collaboration where we've been doing the Lockdown Live series for the past 1 week now, which is going to last for 4 weeks. This week we delve straight into mental health, and we are so honored to have Dr. Lydia on board, who is a mental health expert from Brighton, Sussex, who is going to help us delve into the nitty-gritties on what we need to do, what not to do regarding matters mental health. Welcome and tune in.
So I'm just going to introduce Dr. Lydia Turner. So Dr. Lydia Turner is a consultant psychological therapist at Sussex Partnership NHS Foundation Trust and honorary senior lecturer at the School of Psychology, as well as programme director of postgraduate courses in therapeutic practice at the University of Sussex. So we are so lucky to have someone with such an amazing life of experience to speak to. Lydia specialises in working with adults and children with complex mental health difficulties, in particular adults diagnosed with personality disorders. She has special interest in reducing stigma and negative attitudes towards people with personality disorder diagnosis. Lydia specialises clinically in cognitive behavioural therapy, known as CBT, and has written and co-edited books on CBT and autoethnography. One which I actually had a little look at called Managing Anxiety with CBT for Dummies, published by Wiley. So I will hand over to Lydia to say a bit more about herself, but thank you for joining us.
Thank you. So as Katie was saying, I'm a consultant psychological therapist. So I practice cognitive behavioural psychotherapy, which means I'm interested in the way people think and behave in relation to how they feel. So the therapy that I do and the therapy that I teach involves working with adults or with children, looking at how they think or what they do in order to help them feel better.
Questions for you, Lydia. Our first question is that we have been using technology a lot to work, study and stay connected with family and friends. And we want to know, how has increased use of technology and a shift to the online world impacted people's mental health?
Okay. So I guess that, we're all kind of operating in this system now. So I think it's got some kind of good stuff and some bad stuff about it. So in terms of being able to access things, I think it might be, having to use technology might mean that people are able to connect, might find it easier to connect and to reach out. So certainly even I'm actually finding that I'm seeing friends virtually and seeing people more often than I was doing before the lockdown. So sometimes just having to use technology means that I see people more often. I think that certainly I've worked with some people that are saying actually it's great to use this technology because they didn't feel so good about actually coming into a room to speak to a stranger, and that actually they're far more comfortable being able to sit in their own home or sit somewhere and talk to me on their phone. So that's been really good. I think that some people aren't so able to use it. So when I think about people that I've worked with that are older adults can really struggle to get their heads around some of the technology. So that it might not be so helpful there. And I think that the difficulty with the current situation is that, not everybody has access to technology. And I think that's one of the main issues, that although people generally might have smartphones and something that they can use to connect with, lots of people don't have access to that kind of technology. They don't have access to laptops or to computers. So when it comes to actually being able to work and study in this format, it can be really quite difficult for some people. So kind of, I think that it's got some good stuff in it, but I think there's some drawbacks with it as well.
Perfect, thank you. I'll hand over to Esperance for the next question.
question. We'd like to know whether you foresee any changes regarding approaches in children and young people's mental health treatment due to the current COVID situations.
Okay, so I think that certainly with cognitive behavioural therapy and some other kind of interventions, it can be difficult to deliver in this kind of format. So certainly when I work with children and young people, a lot of the stuff that I do, we write stuff down. You know, we kind of share diagrams and we write stuff down together, which in this forum is really, really difficult to do. So there are certainly some kinds of intervention that it's much harder to do because of the current circumstances. But as I was saying in the last question, sometimes it has made things easier for some people to be able to access it. People that might have been more anxious about actually coming to see me are quite happy to speak with me through some kind of video platform. I think that just going forward from here, I think that what this does mean is that in future, I think we will have to offer this as a platform for people to be able to access mental health. Whereas this wasn't something we were doing before in general services. Generally, you had to come and see us, you know, you had to come and sit in a room with us. We had to be in a certain building, and that was the only way you could access help. I think that going forward, once we do get back to normal, we will still be offering this kind of online forum for some people. So I think it has changed things both currently and in the future.
Much for articulately handling that question. Let me now hand over to Anthony, who will move on to the next.
Thank you very much. Our third question is an important one. And it says that in our preliminary conversation, we identified some general gender differences in responses to the crisis. Men seem to be more silent on mental health, leading to a spike in harmful and self-destructive behaviors. Women seem to be more affected by taking on too much in terms of emotionally, domestically, professionally. How far does this observations match? How far do these observations match your clinical experience? And what can we do to help men and women? And also, do they need different kinds of support and access? And are we too binary in our approach to gender and mental health?
Okay, thank you. Okay, so if I can just kind of take all of these questions in turn, because as you suggest, they're really, really important ones. If I could just take the last one just first, are we too binary in our approach to gender and mental health? I think maybe we might be, yeah. Certainly in the area that I live around in Brighton, we're very keen not to just kind of think of people in either male or female. There's a lot of people that don't identify themselves with these kind of standard gender descriptions. So we might need to just be thoughtful in terms of our language when we're thinking about kind of men and women and others presenting difficulties. So I think certainly it changes from place to place and within kind of regional cultures, but I think we can be too binary, yeah. In terms of your observations and how they match clinical experience, I think probably clinically more women tend to seek help than men. Maybe not, maybe sort of 2/3 women, 1/3 of men. So it's not that I don't see men at all, but they don't tend to seek help as much as women do. And the men that I see do tend to appear to find it a little more difficult to be able to kind of say how they're feeling. And I don't know if you know, but there's a good campaign at the moment by Prince William in this country to try and encourage men to speak more about their mental health and using football as a kind of language for that, which, you know, so just thinking about kind of how we might enter into people's worlds, because at the moment our mental health services are kind of very medical model. They're not kind of very social model. and they are very westernized. So they kind of say, you know, well, this is your mental health, this is your physical health, and they don't kind of think about people as a whole, whereas actually people are whole people, and they're kind of their mental health and physical health and sociological health, and they all kind of combine together. So just in terms of, I think it's also worth thinking about the way in which boys and girls might talk about, I'll use the term loosely, about their mental health in a different way. So girls might be able to say, I feel like this and I think like this and I've got this problem, or I want to do something about it. Whereas I think younger boys tend to not communicate in that same way. They might communicate through the way they behave a lot more than verbally. So I think we need to be open to different forms of communication while not making assumptions about them. So we don't want to think just because a young man is behaving in this way, he's angry or he's upset. We don't make those assumptions, but we might want to notice it and we might want to ask questions. So I think it's kind of picking up on different forms of communication, but making sure we check things out and we give people opportunities to answer any questions, how they feel, to tell us how they think. But we might need to kind of get in there and ask those questions in the first place. And we might be cued into asking those questions by being observant about how somebody's being. Yeah, I'm not sure if I'm kind of answering your question or kind of going off tangent.
You're answering the question.
It's answering, okay. So I guess in terms of do they need different kinds of support and access? Yeah, I think probably what we need to do is we need to provide a variety of different kinds of support and a variety of different kinds of access. As I said, the conventional mental health services in this country tend to be westernized. They tend to be 9 to 5. You tend to have to go through a sort of quite a formal procedure. When before lockdown, you'd have to go into a room to meet with somebody. And I think that restricts a lot of access. So I think we need to, I think probably what the current situation is doing is meaning that we have to be much more creative. And I think we ought to be much more creative. So I'm not, I'll share these with you later, but there's some of the students have been creating videos. So they've been kind of making videos about, you know, just information videos and videos to try and kind of reach out to young people that they're putting on YouTube, just as another way of being able to kind of help access people that might not ordinarily access mental health services.
That has really answered the question that I had. And now I would like to hand back to Katie to ask the next question.
So our next question kind of comes off the back of that one. We were talking in our discussion on Monday and saying that women seem to be more affected by taking on too much emotionally, domestically, professionally with regards to mental health. So obviously men and everyone of every gender does help everyone with mental health as well. But our question is, how do we help others yet protect ourselves when we might be involved personally with those who are struggling?
Okay, thank you. That's a good question. It can be really tricky when we care for somebody and we see them in a lot of distress because we want to do something to help them. The trouble is that we might not always be the best person to help. So I suppose that firstly, we might, you know, obviously we're going to be kind of that sort of non-judgmental sounding board, if you like. We can be a friend, you know, we can be there and we can kind of care. But our main aim might be to encourage somebody to get a bit of help and to seek some help for them. I suppose we can help by doing our own bit of research on what might be out there and how you might access it. So we might be able to say to our friend or our partner or loved one, look, okay, well, there's these services out there, these are the numbers, or this is the website, or this is how you get in touch. So it might then be easier for them to kind of access it. I think what we do need to do though is kind of work, if we're going to, you know, because we can't make people better. Whether you're a therapist, you can't make people better. We have to work with people. So anybody we work with and anybody we care about, they have to want to get help, and they have to want to get better too. And that's tough. It's undergoing any kind of treatment, or even just going and talking to somebody, as we've just talked about, can be really, really difficult to do. So I suppose we can be supportive and encouraging, and help people to make the changes that they might need in order to be able to feel better. So I suppose in a CBT context, in order for people to feel better, they might need to shift the way they're thinking about something, or they might need to change what they're doing about something. And it's all very well and good changing, but you've got to give up an old way of thinking and give up an old way of behaving. And that's the bit that's really, really tough to do. So as kind of a friend or a partner, we might be there to support that process. That might be the sort of the best thing we can do, because if somebody isn't willing to make those changes and they just want to keep pouring their distress onto us, that's no good for us. That's no good for us to keep hearing. So we have to be able to boundary it and be supportive while saying, look, actually you need to go and get some help.
I think that's so important with boundary setting. We spoke about that on Monday, especially in lockdown. So I'll hand over to the next person to ask the next question.
Hello guys, I'm Peter Carter. My question is, what are some of the practices that people can put into place in order to counter attack any mental illnesses, health and mental illnesses?
Okay. So practices that people can put into place to kind of deal with being in lockdown. Okay. So yeah, that's really good to think about. So I think routine is really important. So before lockdown, work or school or college gave us a good formal routine. So we had to get up at a certain time, we had to go to a certain place by a certain time, we had to do whatever that task was, whether it be work or studying, for a certain length of time, behave in a certain way, and then come home at a certain time. So that's really good for us. In amongst that, we saw our friends, and we did some things which was kind of healthy for us. So now, in the current situation where we can't just go out and about, we need to be just thinking about those kind of routines that we used to have before. So it might have been a pain to have to get up early in the morning to go to work or go into college, but actually it's a really good thing. So, getting up at a reasonable time in the morning and setting those parameters for our day, so we're getting up at a reasonable time in the morning and we're going to bed at a reasonable time at night, is a really good place to start. And then put meal times in between. Yep. So we've got sort of that kind of routine of not only when we're getting up and going to bed, but when we're eating. So I appreciate that might sound very basic, but actually it can all go out the window when we lose our routine. We can start to stay in bed later, and go to bed later, and kind of our routines out. So that's a regular time of day. And thinking about the kind of activities that we have during the day, they've just got a good balance. So there may still be studying that we need to do, and we need to make sure that we've got a sort of allocated time for that. But we've also got time to include things that we enjoy. If we've got anything that we enjoy doing while in lockdown, whatever that might be, it might be kind of playing music or whatever it might be, make sure that we have those activities that are good. Also, see if we can get in some activities that are a bit challenging, or something that gives us a sense of achievement. So it might be that doing some studying actually gives you that sense of achievement, or it may be that you need to do something else in order to kind of challenge yourself. It might be a kind of a sporting activity, or challenge yourself to do so many press-ups, or whatever it might be, but a challenge that once completed is kind of going to give you a bit of a boost. And make sure that you're not isolated. So even though you might not be able to actually see your friends face to face, finding a way of just getting in touch with them on a regular basis, being able to talk with them or message them. Maybe you can put online chats or quizzes. You know, quizzes are quite good at the moment, where a group of you can meet together. Or, you know, if you are able to go out and about and meet your friends in obviously a socially distanced, safe way, you know, you might wish to go and meet somewhere and do that and kind of chat. But I guess having those basic ingredients in your day that you might have had before, but you just adapt them to the current situation.
Dr. Lydia, it's a privilege to have had a conversation with you on regard to mental health. I'm quite full of insight right now. Now I'm going to take the mic to Esperanza. Thank you.
Thank you.
Overall, what would be your advice with regards to how young people are trying to deal with the new stress regarding changes coming up after COVID-19, you know, regarding how they'll cope up with the future and the incoming new normal?
Okay. I think it's probably worth saying that it has all been stressful. So I think we need to just kind of normalize that for everybody. To just have sudden change over which you have no choice can be really, really difficult. And everything we're doing now is all brand new. So it can be stressful. Change can be really, really stressful. And just having to kind of cope with new ways of being that are completely different than the way we've been doing things up until now can be stressful. So I think that probably the main thing is we need to be kind to ourselves and kind to each other, and just be patient, because things are different and things have been different. I think that what we need to do though is not kind of catastrophize, because it may be that I know lots of young people's kind of exams and things have been affected under the current circumstances, but actually that's not the end of the world. Studying is a wonderful thing, and you can do that at any age. You don't have to be young to do it. You might, you know, it can be harder when you've got a kind of a job and you're trying to do it on time, but you don't have to, you know, you can. It's this idea that it all has to be done when you're young, and if you miss out your chance, then that's it. And that's not the case. That's not the case. So I suppose just bearing in mind that this isn't going to be forever. It might feel like it is forever at the moment, and things have changed a lot, and they're kind of gradually changing, and they might kind of change a bit again, and we could get locked down again. We don't know what's going to happen, but it won't last forever. There will be an end to it. It will be okay in the end, and we will kind of get back to some kind of normality, even if it's have to have different kinds of medicines and slightly different ways of going about it. But yeah, just be kind to yourself and patient with yourself, and be kind and patient with others.
Wow, that was a really, really insightful conversation. Key takeaway among everything else that is important is that we need to take every day as it comes. This will not last forever. I believe we've all learned a lot. We've all gotten a deep understanding on matters mental health, especially in times of COVID, a more realistic dimension from a professional point of view. And we really, really take it as an honor and a privilege having Dr. Lydia on board to help us get into the flesh of the matter. And we hope that this helps us get an insight on how to tackle mental health in the present day and age, considering the pandemic, and also in future. It's been an honor having Dr. Lydia on board. It's been an honor having you guys tune in, and we look forward to further stronger collaborations, hoping that this is going to help you to get a deeper understanding on how to handle yourself and your fellows around you in these times. Many thanks to Sussex Rights and the Youth Cafe team. Thank you.